Hey there, everybody. My name is Joyce Omondi Wahiga. This is Full Circle with Joyce. Karibuni tena to the second hour of our show today. We're in the middle of our health tips discussion today, and we're talking about coronavirus symptoms and particularly when you should go and see a doctor. Okay, and I'm here with my guest, Professor Mohammed Karama, who's a public health specialist, and I also have Dr. Christine Memusi, who's an E plus medical doctor. Karibuni tena to the show, to both of you. Now, let's talk about prevention. Of course, we have all sorts of directives, from staying at home, social distancing, washing your hands multiple times a day and thoroughly. So it's not just, rubbing your hands under water and going off. You need to do it properly, and also using alcohol-based sanitizers. And there's a lot of questions that are going on about this. The first few days, I think stores were reporting that their shelves for where antiseptics are were all taken out. Disinfectants have been on sale, like selling like hotcakes at this point. But prevention, I think a lot of the information that we've gotten has been very clear that prevention is through social distancing, washing of hands, and using alcohol-based sanitizers. Talk to me then about how contagious this thing is and how it then spreads, Professor.
Yeah, I think the current corona, as we're saying, it's a new corona. We're still learning a lot about it, but it has been confirmed that it's a droplet infection. Mm-hmm. And when we cough, when we touch spaces, people who have corona are discharging a lot of the viruses. Mm-hmm. And this is where we're saying that hygiene practices are the in thing to do at the moment. And hand washing, we are insisting on it because it's anywhere you touch, those droplet infections would be there in public transport, the handles of doors,
and
cars.
The virus has a pretty long lifeline, right?
Yes,
72 hours.
That's what we have discovered in different materials. They can last for 12 hours and so on, and it has a long life. So this is where we are insisting on hygiene practices and proper hygiene practices for that matter.
Okay.
Yes.
Sure. Dr. To that point then, if this is about droplets, then automatically we would think we should all be wearing masks, right? Because if droplets, it's from here, your nose and your mouth. So why aren't we all walking around in masks?
I think if we all walked in masks, then we'd look like is it aliens or something? We would actually scare the public. But the emphasis on masks would be anyone who has the symptoms. If you know you're coughing and you're sneezing, please wear a mask, because the distance of those droplets and the people around you inhaling it is what is actually warranting. Right. And not only just wearing a mask when you're sick, when you know you're having those symptoms, please isolate yourself.
So effectively then, if you don't have the virus or its symptoms, you wearing a mask doesn't necessarily protect you.
No,
because we're talking about touching surfaces.
Yes.
So I could have been covered with a mask, but as long as there's droplets in the surfaces around me and I still touch them and eventually touch my face, I've technically not guarded myself.
Exactly. Because what WHO is actually trying to educate people is how long the COVID-19 is surviving. So that those who are saying, studies are showing that in the air, it can last about 2 to 3 hours. Wow. But when you look at steel, it's a whole 4 days. Okay. So you can imagine that you're wearing your mask, but you're always touching the steel surfaces, the wood, and it'll be there for the next 4 days. So you're really not preventing yourself.
Sure, absolutely. There's some questions that we have coming in from our audience because, again, as we've talked about hand washing, and then they've been very specific about using alcohol-based sanitizers, but the ingredients of the hand wash hasn't been as specific. So what is it about this alcohol? And we understand it should be at least 70%. What is it about the alcohol specifically within sanitizers?
Yeah, the alcohol is a known substance that kills, causes the disintegration of the different pathogens. and the specification for the sanitizers and the sterilizers are supposed to be at least 70%
Okay.
with either glycerin or any other buffer
Okay.
that can be used. But now, because of the shortage, people are making their own,
Yeah.
which could be a risk because they are not meeting the standard.
Yeah.
And therefore, those who are also monitoring this should also be able to look into those sanitizers that are being
Sure.
developed. We are aware that in the country we are running short of this because everybody is rushing towards that,
Yeah.
and therefore we need to look into it to make sure that the standard sanitizers are being used.
So is this to say that if this was a steel surface and there was perhaps a droplet that is containing the coronavirus, an alcohol-based sanitizer would kill
Be
the
able
virus?
to clear, yes,
It
if
would,
it's
okay.
used.
But hand washing does the same thing.
Yes, and I think what we need to emphasize is that the COVID-19 cell wall is very permeable. It's a very thin, so it's very easy to kill.
Okay.
It'll last long, but it's very easy to kill.
Okay.
So instead of emphasizing so much emphasis on hand sanitizer, you could soap and water with Dettol.
Right.
Works.
Okay.
It
All
works.
right. And
It
in
works.
fact, let me turn to the questions now. Marie is watching from Kikuyu, says she's loving the show. Hillary from Meru, asante sana as well for your feedback and your comments. Someone here says, good morning, Joyce. Most of these hand sanitizers are antibacterials. Are they effective against COVID, considering it is a virus? And that's a great question, I think. So, in our understanding, antibacterial is for bacteria.
Bacteria.
This is a virus. Why are we talking about hand sanitizer? But I think it's what you've just mentioned, that the alcohol is what is actually doing the work.
Yes.
Okay.
Yes, yes.
All right.
We are aware that some bacteria could also be, resistant to some level of alcohol, but that's why we are insisting on the current sanitizers to be of that level. This has been ascertained that all pathogens will disintegrate under 70% alcohol.
Okay.
And the emphasis should be not hand sanitizer only. In fact, it's hand sanitizer or hand wash. It
And
actually
hand
should be
wash.
washing your hand with soap.
Yeah.
And if there's no water, then opt for hand
Right.
sanitizer.
The
It shouldn't
priority
be
should be
yes,
washing hands.
Washing hands.
Okay. Iman James from Mombasa is asking, why are they advocating for us to use bottled water than tap water? And is there a possibility that someone can be infected twice? And this is interesting because, of course, as we often hear, there's thousands of variations of flus, right? But if I'm not wrong, you don't get the same flu twice, right? Something about your immunity building up against. Is that true? Does the same logic apply to COVID? Can someone who has already been infected and sort of passed through it, is it possible for them to be infected again?
Well, the cases that came, and I understand where his question is coming from, is that recently in Japan, there were 2 or 3 people who actually initially had the COVID-19 symptoms, hospitalized, got better, but then a week later, after testing, were COVID-19 positive again.
Yeah.
So in such a situation, I would presume that the virus are not completely cleared from the system. And actually, cure from COVID is 2 simultaneous tests that actually come negative.
Okay.
Yes,
2 tests.
2 tests.
All right, that's good to note. Okay. Then he continues to say, na zile sabuni ya maji zinazotengenezwa estates tunaweza tumia kuosha nayo mikono. Of course, liquid hand soaps, lots of people just kind of making their own concoctions and whatnot. Is there any sort of specification about the type of hand soap that one should be using? Or is it more about the process of how they wash their hands?
I think the issue of hand washing with soap, any soap, will destabilize the viruses in our hands, and we'll be able, and with at least some water oozing continuously, we'll be able to remove some of the pathogens that may exist. So what we are saying is, in the absence of sanitizers, then we can use soaps, whatever exists in the house could be used and can be useful to address, to improve the hygiene situation. Yeah.
Absolutely. To the first part of his question, who are these advocating for bottled water versus tap water? I didn't quite catch that one, but is there any logic behind that? Is tap water now unsafe for any reason?
Unless if his thought line is if the tap water is contaminated.
Yeah.
You know, sometimes it could be mixed with sewage, but I do believe that Nairobi Water should always emphasize and try to ensure that by the time the water is coming through your taps, it's at least
And actually, it raises an
cured.
interesting point too. A lot of the surfaces that we've talked about, the virus being carried, it's like hard surfaces.
True.
Can it be carried in liquids? So say water, can someone get sick by ingesting a virus? Is that even possible, or is that more of a bacteria form?
Actually,
And same with food.
If we were to think in those lines, so in plastic surfaces, it lasts 3 to 4 days. Steel is about 2 to 3 days. So I would inversely change that question. If you had a plastic bottle that was held by someone who had COVID-19 and you hold it and drink it, you could actually be drinking some of the droplets, or maybe touch the droplets with your hand and then
Right.
infect yourself. With taps, I think it's all about, what I would say about COVID-19 and water, it just goes back to basic hygiene.
Right.
It
But when it comes to, say, food preparation, if someone,
Has
and
the
hopefully
COVID.
this is not happening, say, for example, someone coughs over food that they're making, or a
Right.
drink that they've prepared,
Right.
and a droplet gets into their food or into the drink, and someone else drinks it, is it possible to get infected that way?
Well, we haven't heard of COVID-19 being transmitted by food.
Yeah.
Because I go back to the point that the cell wall is very permeable. It's a very easy virus to destroy.
Okay.
That should be the message. It's a very easy virus to destroy. So
Okay.
the cooking process should actually destroy the virus. But if it's a cold drink, maybe, just maybe, but we haven't had symptoms or people saying that they drank a drink from somewhere and got that, because
Okay.
we haven't really looked at it. We're still trying to understand the transmission and spread of the COVID-19.
Okay. Lily from Eldoret is asking, what if someone has a high fever but no cough, no difficulty in breathing? What could that be?
I think it's important at this point in time to live through exclusion. In other words, any symptoms that are similar, one has to exclude the possibility of corona. And therefore, it is important that we indicate that, we make sure that whatever symptoms that you have
Yeah.
are not corona.
Okay.
And it's clear that the influenza that we've had for a long time has close to similar symptoms.
Okay.
But the influenza and the other flus have, you don't have a running nose.
Yeah.
You have, a productive cough or something like that.
Okay. All right.
Uh,
So let's then boil down to the main question for today, which is, at what point then should we be coming to see you guys, to see doctors? Because we've been told stay at home, resources are limited, treat it at home, really has been the message, that we could possibly treat ourselves at home. At what point is that true? Because we're also hearing cases of people being rushed to hospital in the middle of the night because their symptoms have just gotten really, really bad.
Right. So what I would say is that symptomatology of COVID-19 has 2 phases. There's there's acute phase, but we'll call it non-symptomatic. You'll have the symptoms, but really at the end of the day, 89.9% get cured.
Yeah.
You'll have the dry cough. You'll have the high fevers. You might even have malaise.
Okay.
But in 2 weeks, completely healed.
All right.
But there's a 1.9%, or that's really small number, who now develop into the severe.
And what are malaise? Sorry, you mentioned.
Malaise is just basically body aches, the
Okay.
weakness, generalized body weakness.
Okay.
But there's a 1%, 1.9, 1.5%, who now develop the severe symptoms, where the chest pains. Where
Okay.
by the time you're developing chest pains,
That's probably a good sign.
That's a good sign that you actually do need to
Okay.
be seen in a hospital setup.
All right.
Because by the time you're having difficulty in breathing, then you actually need assistance
Sure.
to breathe. And that
Okay.
is a time now you actually do need to be seen and admitted and
Yeah.
catered for, because difficulty in breathing means you're not breathing at all.
Yeah.
Yeah, so
Well, we literally have just a couple moments here to go. So I want you guys to demonstrate for us very quickly using the sanitizer how we would safely wash our hands, or at least sanitize our hands properly, if you wouldn't mind. So you could just pass this along and we'll do so just now.
I think maybe the demonstration should not be how to use the sanitizers, but how to wash
Yes,
our hands.
we're going to pretend this is the water for now.
Ah, okay. All right. Okay.
So,
Maybe Dr. can do that.
yeah, go
Washing
ahead,
hands.
Dr. Mhm.
First, we need to understand that pathogens exist
Yes,
in
Yep.
our hands
okay.
yeah.
and between our fingers
Mhm.
and also under the nails.
Yeah,
So people with long nails need to take care of themselves
right.
very much.
Yeah.
So the first thing is when you have water oozing,
Mhm.
you
Wet your
destabilize.
hands first.
You destabilize this with water before
Mhm.
you use the soap,
Okay.
and then you now use the soap.
Right.
Okay.
Okay.
And when you do this, you are now actually removing them from wherever,
Right.
and then you will realize that in between your fingers, you use your right hand
Okay.
to go through,
Okay.
yeah, and then you use your left hand to go through this
Yeah.
other side.
And you could do it this way or this
Yes.
way.
Yeah.
No.
No, we
This
will go
you
there.
start. You
Oh,
will go
okay.
there. So you wash this side,
Mm-hmm.
and then you realize your nails.
Yeah.
You can clean using your palm
Yeah.
from both sides,
Okay.
and then the thumb has
Mhm.
to get special attention
Right.
on itself alone,
Okay.
and then the wrist.
And then the wrist. Yeah.
Okay.
Too many people forget to reach the
Mm.
wrist.
Yes,
Come.
and then the top of the hand before you reach the wrist. Actually, you need now to wash,
That's a good
because
point.
people
So,
forget
Yeah,
this part.
this is
Yeah.
not the same as this.
No.
This
Yeah.
is focusing on the fingers.
Fing-
This is focusing
focusing
on the
on the
top of
back.
the hand.
Yes,
Very
yes.
good point. Great.
So that's how, and then you can use now the
Sanitizer.
sanitizers in whatever condition that you have, and
Great.
I want to appreciate some of the counties where they have made their own
Okay.
because of the shortage, and
Yeah.
they have distributed in few places.
Yeah.
Yeah.
Great. Thank you so much, Professor Ann Daktari, for your time here today. I think this has been a valuable discussion. Lots of people here saying that the show has been very educative. How do you know you have COVID-19? We've talked about these symptoms already. A dry cough. We said fever, especially, would be one to look at. So, and you can continue Googling these up, and of course, following the Ministry of Health guidelines as well. Ruth kutoka Dagoretti anasema tunaweza osha mikono na sabuni ya okay, I guess bar soap. Yes, we've said the type of soap does not matter. It doesn't have to be an expensive type of soap. Has there been any reported cases of recovery in Kenya?
We are still
Yes,
following
some
that.
people have been discharged.
Some people have been discharged. All right. Thank you once again for your time. We're going to take a short break now as we switch gears and jump into relationship talk. Okay, Benjamin Zulu is going to be joining me here on set in just a moment. And we'll be talking about self-awareness and how you can improve your relationships. This and much more here on Full Circle with Joy. Stay tuned. I'll see you shortly.